Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to answer the question, why are patients having credits on their accounts? I have a lot of people asking me this time of year why it looks like there's so many patient accounts with credits. So that means that they have paid towards something, but the insurance didn't adjudicate their claim to make them responsible for something. Usually it's copays, and that's frustrating for some business owners because they don't want to write checks to patients to pay them back that credit. Now, let me just preface this with, if you regularly see a patient and they have a credit on their account, and if it's not too high, then I would suggest keeping that credit on their account and using it towards a future visit, especially if they're frequent flyers or you are in a type of medicine where they have regular appointments every week, every month, however often. And making sure that you're putting some kind of alert or notice for the front desk to understand they have a credit so they don't keep collecting that copay or coinsurance when the patient is checking in. The first thing I would do is check the date or the year of their insurance plan coverage and find out what the start date is and when the end date is. Because my guess is they are towards the end of their insurance coverage year, and there are a few different scenarios we're going to talk about, but knowing that end date is super important, because if you are getting close to that end date, then holding on to those credits is totally fine, because once their new insurance coverage or new insurance plan year starts over, they're going to be responsible again for things out of pocket, and you can totally apply that credit to future visits. But you want to make sure, one, that you're putting a notification to your front desk not to keep collecting, and two, to your billing system, a billing team, billing company, notify them when you do want that credit to be used so that they can apply it once there is a balance on the account and they see the credit, they just bam, apply it to whatever it is, and then they no longer have that credit. But there are a few scenarios that you should be checking for patients in their benefits, like going on to the payer portal, logging in, looking at their specific insurance benefits, and seeing what's causing this credit. Because remember, you could be checking eligibility and benefits, and if they're responsible for a certain copay or coinsurance, your staff is doing the right thing by collecting that amount, because you want to capture that up front before the patient is seen, especially with copays. Copays should always be paid at the time of service. So if they're collecting that and you're seeing it as a credit, there's something going on. And you don't want to penalize or get upset with your front desk because they're doing what they're supposed to be doing. You just need to do a little bit more investigating when you see this. So the first thing is, besides looking up their plan effective date, which hopefully your staff is already entering in their demographics, their plan dates with their coverage, so you don't have to go in and look that up. You can just look in your own system, but that is something you can find on the provider portal. So the first thing is you want to make sure they're collecting the right amount of copay. Maybe you're billing out as place of service 11, which is just a medical office, and they are collecting for place of service like 20 for an urgent care, because maybe you do immediate care and primary care and you're billing it out as place of service 11. So that copay responsibility coming back is going to be for the medical office copay, like a primary care copay, versus an urgent care copay, which would be a little bit higher mostly. So just make sure that you're collecting the right amount for the right place of service in which you're billing. Two, make sure that you're in network versus out of network. Maybe they're accidentally collecting an out of network amount of copay or coinsurance than the in network. So make sure you're checking that. Check the out-of-pocket maximum for the patient. Since it's getting close to the end of the year, which about probably 85–90% of people have insurance plans that start over on the first of the year, we're in the fourth quarter, and people who have chronic conditions or had something horrible happen throughout the year medically, then most likely they've hit their out-of-pocket maximum and they don't have to pay anything out of pocket, including copays, until their insurance plan year starts. You need to call the payers and find out if the patient is being seen for anything COVID related, if that wipes clean and they don't make them responsible for any cost share, patient cost share amounts. So if they had a COVID test, a COVID diagnosis, a lot of insurances are still waiving those patient cost shares. So I would definitely be asking, if you can't find it on their portal, the information, call and speak to a customer service representative and say, I notice all these patients that we're doing COVID tests on aren't being held responsible for a copay, coinsurance, or things going to their deductible. Is there something that you guys are doing that is negating that patient responsibility? Also, if they say yes, then find out when that program will end so that you have anticipation for that. Also, I would check into the patient's coverage, because sometimes patients don't have to pay copays towards an office visit code like a 99203, 99213, but they do have to pay copays for any additional services done during that date of service. So if a patient is seen and billed for an office visit, but they also had a UA done, a strep test, something like that, maybe their insurance only makes them pay for a copay for those labs or any other services. So if you're not billing any additional services and it's just the office visit, they wouldn't have a copay. So in that case, it would be a credit because they weren't seen for any additional services in which a copay would be applied. There's just so many things that go on in the insurance world when it comes to patient responsibility, patient cost shares, and how they process things, that these are things that you need to look into if you're seeing a trend, especially with certain payers or certain codes, that you need to dive a little deeper, contact your provider relations person at the insurance or call customer service and ask more specific questions and dig a little deeper. The better knowledge you have about the possibilities that could be behind the credit is very important. And that's why I'm doing this video, because unfortunately it's not as simple and cut and dry as you would hope. There's so many different factors, so many different possibilities, that I wanted to be able to give you that knowledge and power so that when you call the insurance, you feel like you're ready to ask the right questions and get the answers you need. The other thing that I would say is that it's good to stay on top of these refunds. So if you do have to actually write a check to the patient because you are in a specialty where they don't come in very often, or it's a really high balance that you owe back to them, staying on top of it will make it a lot easier for the owner, provider, or yourself, if that's you, to write those checks than trying to do a huge chunk at once, because that's money out of your account that you've already accounted for that you're hoping to pay other bills or your staff with or whatever. And so if you can do it in small increments, like maybe once a month or once a quarter with your bookkeeper and accountant, it's way easier than trying to do it once every 6 months or once a year. So you are most likely going to have to write checks to patients. It happens in every business, no matter how on top of it you are or your staff is. It's just sometimes patients get credits on their accounts and you're going to have to write them checks. But definitely be checking those, figuring out exactly why insurance isn't making them responsible for anything, and then it will help you in the future with other things in this situation as well. Also, insurances always put co-pays as patient responsibility. So you'll see on the ERA EOB, I think the CAS code is PR-3, and it's patient responsibility copay. And that means that it's acknowledging that the patient has a copay for that service. So if you don't see that on an ERA, then they're not making them responsible for a copay. So if you collected it, that's another way to look at it. And we can't argue with the way that insurances process claims to a certain degree. Like, we can get upset if they're not covering a certain code, or they should cover a code that they're not, or they should be reimbursing higher than they are. But when it comes to the patient responsibility, that's all between the patient and the insurance company and the plan in which they've chosen. There's not a lot of control we have over that. So just keep that in mind as well. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. Take care of your guys' selves, stay healthy, and we'll talk to you next time. Bye-bye.